And on to our next speaker. Our next speaker is Professor Dinggang SHEN, Professor and Founding Dean of the School of Biomedical Engineering at ShanghaiTech University. He will be talking about the China experience, integrating AI into the clinical workflow.
Thanks for invitation. I work in US for almost 20 years, and then I returned to China to build a second company in United Imaging. And I try to incorporate our research for clinical application. And also in the meanwhile, after I returned to China, I built a biomedical engineering school in ShanghaiTech University. So I spend my time in United Imaging Intelligence and also in ShanghaiTech. So basically I'm doing research as a professor, and I'm doing product development as a co-CEO for the company. So I try to basically introduce my experience how to integrate AI into the clinical workflow. And I would say, in China, we have remarkable progress, and this is highly related to the National AI Initiative and also large-scale health system. And also, China, we have a large population, so we have rich data resource. But most importantly, in China, we have very strong engineering capability. As we already know in early this year, like DeepSeek. This is not only algorithm development, not a system development, this is a whole system optimization. And as you can see in 2022 survey, so basically, in China, like 62% of radiologists using AI in their daily diagnosis. And you can see, for example, hospital in the West area use more, AI compared to, physicians in the East Coast. This is also reasons because you want to develop AI and then bring this kind of experience to the area. Physicians, they don't have a lot of experience. And also in China, like US, we have FDA. So basically approve all the certificate for AI use. And you can see by the April 30 this year, we already have 113 certificate for AI use, and this certificate has been used for image acquisition like CT/MRI, DR, and also the cardiac disease. Like we are all interested in this conference, and besides it, a lot of disease like diabetes and even pediatric development. In the light, you will see basically this is approved certificate in China. So this is highly related to the field. For example, in the left, you can see I'm working in MICA area called medical imaging computing, computer-aided intervention. You can see large increase of the paper submission as well as Excel paper. In the right, you can see, for example, 20 years ago, China maybe only have 5% of the MICA papers in the MICA conference. But this year, we have almost 50. So it's a large number of the increase. This is highly related to the, in 2014, I built a mix called the Medical Imaging Computing Seminar. Right now, we have over 3,000 people attending conference physically in China. And also, I bring MICA 2019 to China in Shenzhen, just near to Hong Kong. I think this is all related. We have a lot of research, develop, particularly we educate many people. This is also the reasons why, medical AI develop very quickly in China. So we not only publish a paper, we basically, put this kind of AI in the clinical, applications used in the clinical departments. And application actually from the image acquisition to the disease diagnosis. And I will show you examples, basically what I call the full stack. Everything like I mentioned, DeepSeek, not you are only optimized for one component in your, systems. You have to optimize the whole system. So I always focus on, optimization full stack from data acquisition to the disease diagnosis. And I will show you how the AI can be used for that. Firstly, for example, for image acquisition. And I will use lung cancer, particularly, CT as an example. For CT, for example, you have the dose and you want to reduce dose. But if you want to reduce dose, you will not easy to identify the lung nodule. Then use it like deep learning. For example, right now you can use a diffusion model, right? So you can improve the image quality. In the light, you can see, basically the nodule can be also, improved. You can reduce like 30 to 70% of the dose, but for the physicians, they feel, the quality of the image is improved 8 to 15%. And this is already got FDA approval in 2020. So this kind of technique not only used for CT and also for the faster MR image acquisition. This is a technique we also develop. Basically, we say for multimodality image acquisition like brain, you use a T1, T2 flare, and we can acquire the image within 100 seconds, means 1.5 minute. And this is already used or installed. This technique is already installed in over 600 solidity MR scanner and also got FDA approval in 2020. Same technique is also used for the whole body PET CT. For example, it regularly takes like 15 minutes. I want to improve speed 10 times. In the left, you can see, if you're using regular image reconstruction, you see a lot of artifact and noise. In the middle, use a DLI, hyper deep learning reconstruction algorithm, still 10 times faster, but the image quality can be as high, as good as the regular. You take 15 minutes. This technique also got FDA approval in 2020. And also when I return to, I work both in university and a company. But my style of writing paper is different from people working in the university. In university, you have an idea, and you work day and night, particularly for conference, like deadline, before deadline, you try to publish a paper. But this is very different when I work in the company. All this technique, we got FDA approval in 2020, but we published a paper in 2023. After we installed all the technique in the hospital, people, physician use it, then we start to write a paper. We say we use one framework. We can do the low-dose CT reconstruction, faster MR image reconstruction, and also low-dose and faster PET MR image acquisition. So this is one framework, finish everything. Of course, right now I will talk about, foundation model can do better than what, we did a couple of years ago. So when you have the images acquired, using low dose, of course, with high quality, the next step is like, patients still lying on the, CT scanner. The next AI you will need to develop is basically check any, abnormal lesions or lung nodules in the CT images. So people usually say, okay, you input the image, I want to localize, segment, and classify lung nodule. But this is just purely based on the image. And we have to incorporate the clinical information in the bottom. As you see, the lung nodule actually develop differently in the different part of the lung lobe. So this kind of clinical information you have to incorporate into the network. In this way, you can localize, segment, and do a diagnosis much better compared to only you treat image sampling. So this technique also we got Chinese FDA approval in 2021 and used by more than 30,000 hospital, and every day so for 30,000, 300,000 patients every day. So with a very high quality CT scan and also AI technique, it's a lot of subject, particularly after COVID-19, you found nodules in your chest CT. So then the next step is how can you manage the lung nodule? Of course, physician will be very worried for, if you have a lung nodule. Personally, I also have lung nodule. So the step is like physician will suggest you do the follow-up. Means you scan your CT maybe every year or every half year, depends on the level of the lung nodule. So the technique, like people in the academic area develop image registration. So here is a longitudinal image registration, means compare your current time point image with the previous time point image. But in the field, people always say, okay, we input intensity image, we compare, and then we want to do the correspondence, and then we want to identify the lung nodule, whether the lung nodule is new or existing one. But here, because we already have all the AI technique, means you can segment all the structure from the lung nodule. When you do the image registration, you are not only compare the intensity similarity, you are actually registering all the anatomical informations. And although of course the lung image is large and the nodule is small, in the light you will see you have to use a tracking algorithm to basically do the precise registration for the lung nodule. So in this way you can compare where lung nodule size or mass is increased or not. So this technique already used in over 1,000 hospitals, and every month serving for 1.5 million subjects in the hospital. So this is a paper actually we published last year in Nature Medicine. So we say, there's an international lung-less this kind of standard, but for Chinese and China, whether we can build Chinese lung-less, and this kind of, like a standard can be easily used in the hospital, for example, in the low-level hospitals. So this is what we did. We use AI, like, for example, finally, we train algorithm using more than 40,000 subjects. Each lung nodule we have pathology information. We train this method, and then we build a Chinese lung-less. And in the middle, you will see, if using Chinese lung-less, we can get a sensitivity like 87%. But if you use the international version, just 63%, means you can have 24% of increase for sensitivity. And this is just the algorithm. And in the bottom left, you will see, the algorithm is validated using mobile screen. Means, we put, we have to go to previous slides. Okay. So you see, we put a CT in the track, and you drive this track to the control side, and then subject can go to the left, then go through CT scan, then come from leave the track. In this way, in the bottom right, you will see the AI-based report is already sent out. So this is already used in China. So when we present this work, we try to say we can not only publish a paper in Nature Medicine, and we also put this AI into this kind of track to serve to the patients or subjects in the remote area. So when you have, for example, lung nodule, and after follow-up, you feel, the lung nodule become malignant, then the next step is try to do, one of the ways to do the radiation therapy. Radiation therapy, basically you try to segment, the tumor or lung nodule, then all the surrounding normal structures, then do the TPS, means the treatment planning systems. So for over 160 organs, the whole body, and all the targets. Each one, we can do the segmentation using 0.7 seconds and with a 97% of dice ratio. And this is already installed in the radiation therapy, machine. So suppose this is a video, yeah. So basically here you can see, subject lie down over there. We scan the 3D CT and I show you 2D slides one by one. Then our AI technique in second step, segment of the tumor, segment of surrounding structures, and then in the third step, we're using AI to do the dose planning. And then, the subject still, lie down in the scanner, our treatment machine to start to treat the patient. So this is what we call all-in-one, means, the image scan, radiation therapy, actually in the one step. For the lung cancer, the treatment, 10 minutes, 45 seconds, means a subject come to the hospital. Traditionally, you scan the CT, subject going back to the home, and then physician or manifest manually label, the target or, surrounding normal structure, and then use a very powerful, workstation to do the dose planning. It often take, I will see, for example, in the bottom left, for the rectal cancer, first treatment, including waiting time, 23 days. And if using technique, I just present 23 minutes. And you can see all this kind of tumor. First treatment, we can finish within 30 minutes. Think about if a patient do the first treatment, you need to wait for 23 days. Right now, I can immediately treat for you. This is a huge impact. So I always say, we are developing technique, but if we can incorporate our technique into the product and help patient and help physicians, this kind of technique is more important. And also, you can publish papers in high impact journal. So in the past 7 years, actually, after I returned from US to China, built the second company in United Imaging. We developed over 100 AI applications and 10 AI portal for image acquisition and AI-based diagnosis treatment. And also, the research, basically help physicians doing the research. Then what's the next step, particularly with the foundation model? I think it's very important the technical information model is you can align all the informations in the common space. For example, you have the text information, you have the image information, various images, including the pathology images. You can have the encoder for text and encoder for each modality of the images. Then you align all the features in the common space. In this way, it can provide you a lot of benefit. I will show you. Firstly, even for the image acquisition, like MR image acquisition, people, like E1 or, ADs, sitting here, right? So for the MR image acquisition, think about when you acquire the images, you have all the parameter like text information. And you have the image acquired. Then, you can align all the, images together. So basically saying, image feature and then text information align together. So in this way, if you input any images, you can generate the image you want. So here I just show you not only for the MR image and also the CT image, PET image, all the information, text information, image information can be aligned. Then in the bottom, you can input one image modality, you can generate, other images, even MR to CT, MR to PET, or even CT, you can generate MR-like image, or from the PET, you can generate CT images. So this is very flexible informations. So if we're doing this kind of technique, think about, you can basically, acquire one image, you can generate another image. Physician can read the image side by side. And 2 years ago, actually, in the neurology conference in US, physicians have multiple oral presentations saying, using this kind of technique to improve their clinical outcome. And also, more important thing is like giving the image, you can have the report. This is what we call like image to report. I will give you 3 applications from head to chest for the whole body. For the head, for example, in China, if a subject claims some issues with the brain, they will acquire 5 modality 3D MRI image, and then physician read these images, give the report. So we're using foundation model, basically over 110,000 pair of the image. Each we have the image and the report. We're using this kind of clip technique, align the image information with the text. Then, basically, test on the 10,000 image pair. We can get 85% of accuracy for 32 diseases. I'm studying for the Alzheimer's disease in US. You can get 85% for one disease is already very good result. But right now, you can get even for 32 diseases, you can get 85% because all these brain diseases, they have very basic, for example, foundations. You will see, like schizophrenia or, ADHD, always some network is affected, means, they have the common base, and then if you combine them together, you can improve the performance. And also, like a chest, for example, we work with the Zhongshan Hospital in Shanghai. We use over 400,000 images, the patients. Each patient has the 3D CT image and a report. Align this kind of all information together for the 73 chest, disease, we can get 94% of accuracy. This is much higher to the, the best one in the world, 74. And we already make this as a product in ICMIS last week. We show, these results to the physicians from all the world. And the physicians, basically, they are very happy to see, like, this kind of foundation model can help them, scan a 3D CT image, and you can get 97%, 70, 3 kind of disease. This is my last, example. So for the whole body, PET CT, if a patient with a tumor, you will scan the whole body. We want to see where the tumor is basically moving to the other place. Physician need to take 1 hour or several hours to read all the slides for the whole body and later report. We use this kind of foundation model. Of course, this foundation model, you need to integrate with the small model we call the very specific AI model. For example, you can identify information in the report, identify the organs in the image, then you align the information like a clip. So this is very important. Combine foundation model with a specific AI together. Then this kind of AI technique can write a report very closely with the physicians. And this technique is already installed and used by over 200 hospitals in China. And although, we are doing clinical trial to get Chinese FDA approval. So this is my last slide. I would say, medical foundation model can provide you the opportunity to align all the information, not the image we are interested, and also text information, gene information, even video or voice information together. Then you can do the various tasks you are interested, not only for the image acquisition, you can do diagnosis, even report generation as I mentioned, and also the treatment recommendation. So basically many applications we can use. Besides the medical foundation model, the next step is agents. Agents means not only using software, it can also call for the hardware. So in that way, you can really use an agent to help the physician and also basically provide the benefit to the patient. Okay, thank you.
Professor Shen, please remain on stage. We'd like to welcome Professor Chan back on stage to present a souvenir to you as a token of appreciation.